We're going to do a cephalic catheter on Hoku here. So first I want to point out my supplies. I have my tape all lined up. I have my shaver here. I have my T-port, which I'm going to go ahead and flush with heparin. And heparin is 10 units per mil. And then the catheter I have, these are new catheters we're using. They're safety catheters, so the needle's going to come up into this plastic part to protect anyone from getting restuck. However, doing that kind of makes it so you can't pre-flush with heparin. So when I put the catheter into Hoku, I'm going to make sure to attach my T-port right away and flush the heparin as soon as possible. Then I have my Chlorohex scrub and I have some alcohol on standby, and I have my vet wrap for when we're all done. So first I'm going to have my restrainer hold up the leg. Good job, Hoku. Then we're going to clean 3 times with the Chlorohex and 3 times with alcohol. Chlorohex, alcohol, Chlorohex, good girl, alcohol, that one last time. Guess I'll start all over again if you look at that. Chlorohex. And alcohol. Girl. Make sure my hands are dry. Alright. So I have my catheter ready. Make sure it's bevel up. You ready? Mm-hmm. Oops, got a little vein on this side. Okay, catheter's in. Next is tape. Don't move till they get this in, Hoku. Tape in. There we go. Okay, so now that that's in, take this out. Oops. So that's the disadvantage of having a white dog, but that's okay. Flush with heparin. Can we still see me on the camera?
Yep.
Okay. Okay, so I'm going to make sure this goes in, which it is. And I'm going to cut this off. And what I mean is just, so sorry, it's got a little bloody. Putting the tap back on, which did not go on the floor. And unfortunately, got a bit of a mess. My sincere apologies. But we know the catheter's in, so try and look on the bright side. Hoku, you are so good. Okay, next tape. Okay. Put your cap in. Just putting your extra tape around it to make it nice and secure, since we have some extra fluids around. Next, I'm going to tape the T-port in. Shh, I'm so sorry. I'm so sorry. So this holds the T-port in place. Good girl. And then this is going to hold, oh geez. Okay, so the catheter is in. When you have a white dog, unfortunately, it looks a lot more horrific than it actually is. Everything's fine. Then we are going to wrap with vet wrap. So the vet wrap's just going to prevent her from messing with the catheter before her procedure, which stays on like that. Some things you want to be careful of when you're putting in a catheter is, one, got to make sure that you stop the blood pretty quickly. But we're in the vein, so we know that. You don't want to go through the vein or make the vein blow, because the medication's not going to go into the vein if you're doing an IV. So that has to be very careful. You don't, blow the vein. And then you want to flush your catheters and your T-ports regularly to make sure they don't clot. Then they wouldn't be getting medication, or you can tell by your pump saying error. That means that the catheter's been clotted. So the heparin's going to prevent the any clotting within the catheter, excuse me. So you want to flush, check every hour, definitely want to flush daily, and then you want to change your catheters every couple of days if it's long term. Okay.